Speaker.
Are there any constituency statements by honourable members? And I call the member for Warringah.
Thank you, Madam Deputy Speaker. The COVID-19 pandemic is not over. Just yesterday, across our nation, there were 41,238 new cases of COVID-19 recorded, noting that it's widely suspected that there are many more in the community going unrecorded.
A division has been called for in the House. The proceedings are suspended to enable honourable members to attend the division. The proceedings will resume when the Chair of the Federation Chamber is resumed at the conclusion of the division or subsequent divisions. Let's go, guys. Let's go. Did the member for Warringah actually get to say anything? She did. Are we continuing with the constituency statements? Yeah. So we haven't got a quorum anyway.
Oh, great. I thought you'd come back. Do you know how long we've got? Well, there's going to be like 10 amendments this morning. So.
Oh my God. Order. The member for Warringah in continuation.
Thank you. Just yesterday, across our nation, there were 41,238 new cases of COVID-19 recorded, and sadly, there are many more in the community. The impact on our health system needs to be acknowledged. We currently have so many cases treated in hospital. Incredible teams of health workers supported by incredible ancillary staff. And it's important to note that statistics have names and faces. Each death is a beloved family member no longer at the dinner table. Each patient is a human being struggling for oxygen. Each healthcare worker is an exhausted nurse or blistered cleaner working on the front line. We are yet to see the impacts of long COVID, potentially debilitating condition which follows the acute or early phase of COVID infection. Symptoms have been shortness of breath, fatigue, fever, headaches and brain fog. And there is a fear amongst many professionals that our health, welfare and disability services are underprepared to support the growing number of Australians with long COVID. This is a challenge recently acknowledged by the Health Minister himself, and I welcome his commitment to seek advice from the experts to address long-term impacts of this virus. There are 5 key requirements at a national level that have been recognised by the University of Sydney. First is surveillance for long COVID to track rates, symptoms and impact on work and quality of life over time. Secondly, to better support and resource for GPs to treat long COVID in primary care. Thirdly, more specialists for long COVID clinics for those with more complex problems. Fourthly, disability supports for people whose problems have become long-lasting. And 5, research to understand long COVID.
Being called for in the House, the proceedings are suspended to enable honourable members to attend the division. The proceedings will resume when the Chair of the Federation Chamber is resumed at the conclusion of the division or subsequent divisions.
Over on this side. So you're doing a 3-minute? Of course you can. So usually
And I call the member for Richmond.
Thank you, Deputy Speaker. And today I rise to speak on the Albanese Labor government's decisive action on climate change. Our country needs desperate action. And finally, we have a government that's acting. The climate wars are over. The decade of inaction is over. Our country needs this, both environmentally and economically, to drive the jobs of the future, to bring down power prices, to make our country a renewable energy superpower. Deputy Speaker, the risk of climate change is real. The science of climate change is real, and the impact of climate change is real. And my community on the New South Wales North Coast understands this because we have been living it with the devastating floods that hit our region. It destroyed lives, livelihoods and homes. Local economies were devastated, communities heartbroken, and so many people are still very traumatised following on from these horrific floods. We understand how real the need is to take action because we are living it. We are living it in terms of the climate emergency. And the Prime Minister made it very clear yesterday, after a decade of inaction, the climate wars are over. And of course, the Labor government's climate bill has just passed the lower house today. Now, to the people of Richmond, you elected me to be your strong voice in a majority Labor government and deliver action on climate change. And we are delivering on that mandate, a plan that will reduce emissions by 43% by 2030, a plan that will reduce power prices and get us to net zero by 2050, a plan that will create 600,000 new jobs, with 500,000 of those in the regions. Now, this is a plan supported by both business groups and environmental groups. This plan gives economic certainty that our economy needs. I'd like to acknowledge all those groups in my region who have worked so hard on this issue for so many years. Deputy Speaker, we've had a wasted decade of denial and inaction. At the last election, people in my electorate voted overwhelmingly for this to end. They voted for a strong government with a focus on a better future for all. They voted for a government that takes climate change seriously. They rejected all of that years of inaction by the Liberals and Nationals. They had 22 plans and didn't actually do anything. And what's been their response now? They're just pushing nuclear power. Yet again, they are pushing nuclear power. The Leader of Opposition announcing a review into looking at nuclear power yet again. And the fact is, nuclear power plants can be dangerous and expensive, and of course they use too much water and need to be located near water. And, well, Speaker, I always stand with my community in firm opposition to nuclear power, and I will keep fighting this. We need investment in renewables, not nuclear. It's only a Labor majority government that could deliver on this vital economic and environmental reform that our country needs, acting on climate change and ending the climate wars.
I call the member for Lyne.
Thank you, Madam Speaker. I'd like to take this opportunity to recognise the stellar contribution made by well-known Manning Valley identity Dennis Hawkins, OAM. He was the Chief Executive Officer of the Bushland Health Group, and he's retired after 43 years' service. Dennis has overseen a massive transformation in the Bushland Health Group, a community not-for-profit organisation that delivers a broad range of services including aged care, home care, disability care and retirement living. Dennis began his career with the Main Roads in 1969. 10 years later, he then went on to complete his uni studies in health administration, working in the public hospital system, being an administrator, before moving back to Taree to take up administrator role of the new Bushland Health Group, which then was known as Manning Valley Senior Citizens Homes, back in 1979. Working with the Board of Directors, Dennis has shown outstanding leadership. When you look at what he's accomplished in his time as CEO, it's second to none. From that small group, they went on to run a private hospital for a long while, but they've developed residential aged care facilities at Banyula Lodge, Alkira Lodge, Karingal Gardens, for retirement living at Jacaranda Avenue, Jarrah Place, Warana Place, Parklands and Bushlands Place. They are also, and I'm very proud to say, at the forefront of delivering a massive project on the banks of the Manning River. As a federal member, I work with them to get a federal government grant to support the head works like roads, traffic lights, sewerage for the fig trees on Manning project, which Bushland Health is delivering. It will enable subsequent further sites for Bushland Health to deliver retirement living complexes. And it's just down the road from Coringal Gardens residential aged care facility. But the absolute economic boost to the Manning Valley will be huge, because following in behind them, other owners of land in that area will develop up to $500 million, and that's in 2011 dollars when this was first proposed, more residential and commercial development in that space. So Dennis, all of us who know the work you've done in the Manning Valley for residential aged care and for general support of the community, a fantastic career, well done, and we all salute you and your family and enjoy your retirement.
There being no further constituency statements by honourable members, the next item of business will be called on.
I move that the Federation Chamber do now adjourn.
The question is that the motion be agreed to, and I call the member for Longman.
Thank you, Deputy Speaker. Well, it's an honour to be back. And thank you to the people of Longman for putting your faith in me to represent you in federal parliament. Thank you to all the people that helped in my campaign, in whatever capacity that was. Thank you for standing in the rain and putting up with the horrendous behaviour and lies being told by the unions and some of the volunteers of other parties. Thank you for sticking to our values and not stooping to their level, and to behaving in a manner that I'm proud of. And thank you to my family for the sacrifices they made during the campaign. When I first came to this place, I was determined to be a different politician. I wanted to be someone who didn't make it personal, to be someone that stuck to policy, someone that focused on the needs of their community and did their best to meet those needs. I said then if I was to win, I wanted to win by talking things up, not by tearing other people down. Many told me I couldn't win with a positive campaign and not bagging other people, but here I am. And I'm proud to say that we ran a local campaign that didn't tear down other opponents, that just contrasted the difference between the different parties' policies and results. I stuck to what we had delivered for the people of Longman and what my vision and plan for our community is. All I can promise you is more of the same. Deputy Speaker, there are so many issues and changes I'll be pushing for in this next term, and the one I want to speak on today is integrity and honesty in political advertising, particularly during campaigns where many people are more politically engaged than they normally are. I know it would surprise many in this House that many Australians just get on with their life and don't give a second thought to politics until elections roll around. I find it incredible that private businesses have to ensure truth in advertising, and yet political parties and politicians don't. In my retail background, if we advertised a product that was on sale and that it had been reduced in price, we had to substantiate the original price or there would be consequences, and rightly so. Surely the leaders of our country should be setting the example when it comes to honesty, integrity and respect. For me, any proposed advertising, marketing or statements made by parties should have to be fact-checked, and if they are found to be false or misleading, then the perpetrators of the falsehood should be forced to retract and apologise and face substantial fines and other consequences. The Australian people deserve to make a decision on how they cast their vote on facts and not fairy tales and lies. Some examples of these lies that were told in the last campaign in my electorate of Longman were these. We had one candidate saying they were going to keep interest rates below 3% for 5 years, which of course no government can guarantee. We had several candidates and parties saying at a federal election, no more vaccine mandates, which of course there are no federal mandates, only state mandates, which is misleading and preying on people's emotions. We had one candidate and party saying the coalition was going to bring the cashless debit card for aged pensioners, which is a straight-out lie, and cause stress and angst for our most vulnerable, all to try and win votes. Simply disgusting. Then there was the practice of making election promises on things that I had already announced as a decision of government. I speak of the $5 million for the Caboolture PCYC, which I announced in January this year as funded and done. The Veterans Wellness Centre, which I announced in April this year. The change to the DPA status so medical practices in Longman could recruit more GPs, which I announced I had already achieved in January and March. These were already happening, budgeted decisions of the previous coalition government, and yet this party and candidate tried to again mislead the people of Longman by making out they were going to deliver these things if they were elected. Dishonest behaviour with no consequences. Something must change in this area. The Australian people expect it and they deserve it. In closing, Deputy Speaker, I say to the people of Longman and Australia, I will continue to be your voice on issues that matter to you. I will endeavour to act with honesty, integrity and respect when representing you, and I will continue to talk up our great community and country as long as I have the honour of doing so. Thank you.
And I call the member for Robinson.
Thank you, Madam Deputy Speaker. I rise in the chamber today to discuss an issue that has been deeply affecting the residents of Robertson. However, this issue is absolutely not limited to Robertson. It is felt right across the country. This is not a new or recently emerging issue. This is an issue which affects us all. No matter your age, your gender, ethnicity, income or postcode, this is an issue that affects people's lives each and every day. This issue is access to a general practitioner, or GP. Time and time again in the emergency department, I saw countless patients presenting throughout the day, in the middle of the night, both adults and children, as they were unable to access a GP. Chronic illnesses like hypertension, high blood pressure or hypercholesterolemia, high blood cholesterol spiralling out of control and resulting in extreme consequences like acute myocardial infarction and cerebrovascular accidents, or more commonly known as a heart attack or stroke. Or the diabetic patient with blood sugar levels spiralling out of control, resulting in significant micro and macrovascular complications like retinopathy and nephropathy, all being due to the inability to access a GP for ongoing management. When talking to the people of my electorate of Robertson, one of the major issues raised on the phone, knocking on doors, at street stalls, is access to healthcare, in particular, access to a GP. The role of general practitioners, the role that they undertake is vital. They provide holistic preventative care, ensuring patients do not deteriorate and end up needing critical intervention, such as the emergency department. Preventative medicine, through general practice, is an essential part of our healthcare system that must be supported. Preventative medicine eases the burden on our hospitals. Preventative medicine is preventative. The inability to access a GP should not be an issue within this country, yet sadly it has been for quite some time without any action being taken to rectify this escalating crisis. Until now. Just weeks into the term of our new government, we've hit the ground running. We have, together with the Minister for Health, the members for Shortland and member for Dobell, announced that the entire Central Coast region will be classified as an area with a shortage of medical practitioners, known as a Distribution Priority Area, or DPA. This classification opens the available pool of doctors able to now come to our region, improving access to healthcare for all. Labor recognises the need to improve access to healthcare, as without this vital access, we fail to manage the health of our community and the financial burden on our economy escalates dramatically. From my time in the emergency department, I clearly recall a particular patient. This particular patient, to me, could not have made the consequences of failed access to primary care, both health and economic, any clearer. Although I will always recall this patient as such a strong example of these consequences, they represent just one of the vast number of patients that presented each shift with an unnecessary deterioration of their overall health. This patient, a kind, friendly 67-year-old woman, had a urinary tract infection. At first, she experienced only mild symptoms and sought the services of a GP for basic investigations and the likely prescription of oral antibiotics. Now, had she been able to access this time and cost-effective service, her infection would likely have resolved quickly. However, she was not able to book a GP appointment for nearly 3 weeks due to service availability. While she waited for her appointment, her symptoms worsened significantly, and her infection became systemic, resulting in sepsis. She was rushed to the emergency department by ambulance, critically unwell. Not only did she now require the services of an ambulance and her local emergency department, she required a bed in a ward and the intensive care unit with intensive nursing care, extensive monitoring and extensive follow-up from additional services. Unfortunately, each service, each bed in a ward, all comes with a heavy price tag. And how is this an effective way to manage our community's health? Members of our community should not have to schedule to be sick, and that's why Labor is making it easier to access a doctor in my home electorate of Robertson with the establishment of an urgent care clinic. That's why we're cutting the cost of medications and expanding access to the Commonwealth Seniors Healthcare Card.
I thank the member and call the member for Wentworth.
Thank you very much for this opportunity to speak. And thank you, Ms. Speaker. Ms. Deputy Speaker, apologies. So I just wanted to talk in this time about the youth of Wentworth and some of the issues that the youth of Wentworth are facing. And there are 3 issues that I would like to touch on. The first being public education, the second being youth mental health, and the third being housing. And I speak of these issues because these were the issues that were raised most with me by the parents, but also by young people in Wentworth. These are some of the most crucial issues that young people face, except climate change, which I'm very delighted to say that Australia has taken a very positive step forward to this morning in this parliament. So let me start in public education. I spent the last 4 years of my career working with over 200 government public high schools and 40 businesses, helping young people be prepared for the world of work by bringing together people from students from education and people from business. And these are wonderful schools, but you won't find them really in Wentworth, because Wentworth only has one public high school, despite having a population of over 120,000. Wentworth has only one public high school and very limited public education choices at the high school. Now, that doesn't represent the desire of the Wentworth constituents. You see a high degree of public education in the primary school, but the dearth of opportunities in public education in the high school means that, that Wentworth as a community is no longer really engaging with the public education at the high school. And I think this is a significant issue because the community of Wentworth wants educational choice. We have the most expensive schools in the country. The average Year 12 fees for a private school in Wentworth is around $35,000 a year, which is out of reach of so many families. But because there's only one public high school in the area, there is not really that education choice. But you start with education, and then the second piece that I wanted to talk to was youth mental health, because again, this is a significant issue for the community of Wentworth. Again, when I was campaigning, I had a young man who I remember very vividly coming to talk to me, and I said, he asked me, "What are you doing for young men?" And I said, look, I think youth mental health is probably one of the biggest issues that young people, in particular young men, face. And he started, and tears came into his eyes, and he shared that in his own experience, 2 of his friends had committed suicide the previous year, and that he himself this day was on his way to actually get some help for his own mental health. And that is one of the moments, one of the images and people from the campaign that has stuck most in my mind. And I will forever remember him, but I'll also remember those many other people I met on the campaign. And so for, again, doing some further analysis on this, talking to experts such as Professor Hickey in the area, there is an opportunity to do more in youth mental health, particularly in a community like Wentworth. And this is about not just spending more money, but this is about doing government better. And for me, that is what I'm seeking to represent in my role in the parliament, that it's not always about just spending more money that achieves better outcomes. Certainly that is part of it, but it's actually about getting the states and the federal government working together and truly mapping where are the gaps in mental health and where can this community be better served. Now, I'm really pleased to note that Wentworth has its own lifeline opening up in this month. the Wentworth is going, and that's going to give an opportunity for Wentworth volunteers to come and support, young and old and mental health. And I wanted to really congratulate Lifeline Australia and also Daisy Turnbull, who have stood up for this and are pushing this forward. And the last issue I wanted to raise was housing, because that is the other key issue that people raise with me in relation to young people. Now, parents raise it with me because they say, I don't know how my children are ever going to be able to afford a house. And I acknowledge, what the government is doing in this space, but I think we are fundamentally missing some key actions around both housing supply and also around stamp duty reform. And you look at Australia's housing, we have only 400 dwellings per 1,000 people. Now that puts us on some of the lowest in the OECD. House prices have gone up 140%, between 1990 and 2015, and the housing stock is just not increasing with our population. Over that same time, it has just flattened. So I will be urging the government and working, when in my position as a Member of Parliament, to seek some remedy that we can long-term address housing for our youth. Thank you very much.
I thank the member for her contribution and call the member for Macquarie.
Thank you, Deputy Speaker. I may have been here in Parliament for our first sittings, but my thoughts have not been very far from the flood-affected Hawkesbury residents, where anxiety about another flood is very high. And understandably, with more rain forecast and the declaration of the Indian Ocean Dipole by the Bureau of Meteorology, people who are now facing a big job repairing and cleaning up and rebuilding after the July flood now feel overwhelmed and a bit in limbo because of these forecasts. But of course, it isn't a given that a flood will occur. What should be happening, though, is there should be action being taken by the New South Wales government. They should be doing everything possible to mitigate the risk of flood, everything that they can right now, and that includes drawing down the Warragamba Dam, reducing the level, which has stayed close to 100% for weeks, if not months. People are understandably asking the question why the New South Wales government won't just act. It's hard to fathom the deaf ear that these calls are falling on. And again, I plead with the New South Wales Premier, please listen to my community. We know you can't stop floods, but we also know that the conditions right now are unlike anything in memory. The soggy soils with very little ability to absorb local falls and the heavy rain forecast to fall somewhere in coming months. I congratulate New South Wales Opposition Leader Chris Minns and his Shadow Ministers Rose Jackson and Jihad Dibbs, who came and met with Pitt Town residents, because they are willing to act, and they're also willing to look at improving the evacuation routes that places like Pitt Town so desperately need. Unfortunately, we can't wait for a New South Wales government to be a Labor government for this to happen, and we really need the current New South Wales government to act on these measures. Lowering the level of the water in the existing dam using the resources that we have right now would allow for a buffer, and it must be something that the New South Wales government tries. If it doesn't, I fear the New South Wales government will find the anger in the community towards them will be almost uncontrollable should we see more heavy rains. While people are worrying about the future, though, they're also dealing with the past, and that means the clean-up and recovery. 3 new grants have been made available, and there's been good collaboration between the New South Wales government and our federal government in the last few weeks. The 3 new grants are, one is for renters, 16 weeks of support, because we know you don't get back home in a matter of a fortnight. There's a new grant for landholders, up to $25,000 for those who are not eligible for the other funding, the Primary Producers Grant or the Small Business Grant. And there's also just announced the Homeowners Grant, up to $20,000 for people who need to do things to get back home. I know that there's more to do, but these are fast actions to try and make the recovery from this disaster as quick and as painless as it can be. But we know there is much more that needs to be done, and I'll continue to advocate for those things. Deputy Speaker, One of the really significant pieces of legislation that we've passed in this sitting fortnight has been around aged care. Now, this is an issue very close to my heart and to my communities. So I want to talk through what those changes will mean, because there's more to do. We're not finished with aged care reforms. We've really just got started. One of the changes that we've done will lead to a more equitable funding approach, and that means it'll better match the provider's costs in delivering care to residents than the previous government's regime did. This is going to make a difference to aged care providers in my community. What we'll also be expecting, though, and we'll be starting to see later this year, is the publishing of star ratings for all residential aged care facilities, and that'll be in place by the end of this year. That will put a spotlight on the sector, and it'll allow people to actually compare the quality and the safety performance. No longer just gossip and word of mouth, you can actually go and see the data. The legislation also includes measures to extend the Serious Incident Response Scheme to in-home care providers, and I see this as a really significant start to the many issues that we face in fixing home care, such an important part of our aged care services. All of this means greater transparency, and it's a really significant step forward for aged care.
I thank the member for her contribution and call the member for Hawke.
Thank you, Deputy Speaker, and can I begin by commending you on the admirable balancing of your role as a representative for the people of Bendigo with your amazing parent craft. I think it was clear to the House this morning that I have much to learn from your example. I rise to speak on the very important matter of safety in the road transport industry. Road transport is Australia's deadliest industry. We see and hear the tragic stories all too often. Back in 2008, the National Transport Commission found that low rates of pay for heavy vehicle drivers were linked to dangerous road safety outcomes for those drivers, the workers across the industry and the community more broadly. In response, the then former Labor government established the Road Safety Remuneration Tribunal to secure minimum pay rates for these workers and lift the safety standards across the industry. However, in 2016, the former coalition government abolished the tribunal, abolished them entirely. And tragically, in the 6 years since, over 1,000 people have lost their lives in truck crashes across the country, including 259 truck drivers. And in relevance to my electorate, the people of Hawke, the folks of Hawke have been severely impacted by these tragic losses. Now, those opposite spent their decade in government letting Australian workers down across all industries. And we won't waste a single moment. We won't waste the opportunity to stand up for these workers and ensure that all workplaces across Australia are safe for those workers. Roads are the workplace of so many Australians, as I said, particularly those in Hawke. That's why I am absolutely committed to supporting the Transport Workers Union's struggle for safe rates and better conditions for every transport worker in this country. Last week, I met with a delegation from the TWU, including the TWU Victorian Tasmanian Branch Secretary, Mike McNess, and the Assistant Secretary, Mem Suleiman, to discuss their campaign, and I was extremely proud to sign on to the Safe Rate Pledge. Our road transport workers are the backbone of our nation's supply chains. We found that during COVID. Supporting our transport industry by paying our truck drivers fairly means safer and more secure work conditions for those workers and safer roads for our community. Pressure on our nation's truck drivers has real-life consequences, and those consequences, as we know, can be disastrous. The industry is marked by alarming rates of death, injury and chronic health conditions, as well as wage theft and pressures upon those workers to work under dangerous conditions. Road transport workers, alongside all other workers, deserve the right to go home to their families at the end of the day. That is why it is so important that our government works with industry and its members to establish a clear path to safer roads, and safe rates is the key to achieving that. We need to look vertically to the wealthy clients who are squeezing supply chains from the top. The demand for low-cost transport contracts forces operators to slash rates to remain competitive, compromising the safe working conditions of those Australians who keep our nation's supply chains in operation. Deputy Speaker, we need to work alongside the Transport Workers Union to facilitate constructive collaboration between industry, clients and the workforce. We need to empower the Fair Work Commission to set minimum rates and standards for all workers engaged in employee-like work, including transport workers. This protects workers and employers alike and ensures our roads and communities are safer. I commend Minister Tony Burke for his dedicated work on these matters. Transport workers should not be pressured to work harder, longer and faster just to make ends meet. They keep our country and our community moving, and no transport worker should struggle to put food on the table or a roof over their families' heads. Every worker in Australia deserves a safe workplace, and the workplace that is Australia's roads will not be safe for our transport workers and indeed our communities until the fight for safe rates succeeds. Thank you.
The question is that the motion be agreed to. All of those opinions say aye. And no. I think the ayes have it. The Federation Chamber stands adjourned until 10:30 a.m. on Monday, the 5th of September 2022.